I'm John Nash, and I'm a social worker at the Cystic Fibrosis Center. Welcome to our fourth or fifth annual Research Update Night. We do this the in-between years when we don't do our Family Education Day. And it's just a way for us to kind of give you an update as to what's going on in research in the CF world. I think we have a pretty good program tonight. And we're going to start the program right now with Dr. Comer and John Franklin, John's the president of the board of directors at the local chapter of the CF Foundation. And Dr. Comer, as you know, is one of our pediatric pulmonologists. So I'll start with them right now.
Thanks, John. Good evening, everybody. My name is John Franklin. I'm the president of the board of directors of the Northeastern New York chapter of the Cystic Fibrosis Foundation. I'd like to thank you all very much for coming tonight. This is a really exciting time for us. For those of you who have been around a while, you know that we've been investigating a great deal of drugs over the years, and it seems that things are starting to really come to fruition. In fact, a couple of the people who will be speaking tonight will be able to tell you firsthand how the research has benefited them directly with the release of Kalydeco last January 2012. So that's very good. I hope you all had a chance to take advantage of the vendors who are out there tonight. They are the reason we can do things like this because they sponsor this event through their generous contributions to us. There's also lots of information out there about it. The Vertex people are out there, the VEST people, CF Pharmacy Services is out there with some great information on Creon. So there's a lot to go through out there, and I hope you had a chance to do that. We've got a great night tonight. I want to get going, so I'm going to thank you again for coming and introduce Dr. Paul Comer. Thank you.
Well, unfortunately for you guys, more so than me, you were supposed to only hear me for just a few minutes for this intro, but I am having to pinch hit at the end of the program to talk a little bit more. But just want to start out. This is a night about research. I want to talk about what is clinical research briefly, just to get the background to understand, as Dr. Rosen talks a little bit more detail about some of the stuff that's going on nationally, and as I just briefly mentioned, the local stuff at the very end. The CF Foundation funds a lot of research. There's basically two things that the CF Foundation does with your money and all the other money that they raise. One is support research, and then two is support and drive good clinical care and good clinical care practices. The research is not always just the hunt for the new drugs, the hunt for the cure drugs. That's what gets the headlines, that's what we're all incredibly excited about, but if that's all it was, we would have problems. If that's all it was, we wouldn't have made the huge strides that have been made in CF over the last 30 years or so. So the foundation is still continuing to fund a wide range of research, including basic research, basically looking to see how the CF protein works, the protein that is either missing or not working correctly in patients with CF. They're studying more about the bacteria, kind of trying to know your enemy. In the CF lung, the bacteria is the enemy. The more we know about it, the more we can find better ways to kill it and better ways to keep people healthy. And then genetics. Genetics is a field of amazing expansion in CF, and it seems that every time we find out more, we realize how much we don't know. So there's a lot going on there. And then they also obviously work in clinical research and drug development. And the first thing that they did is what they call looking for the low-hanging fruit. Basically drugs that are already out there available that Dr. Rosen, myself, Dr. Kozlowski, Dr. Smith, any of us could just prescribe, but they're not been tested or used in CF. And so if you can find it and prove that they work, you don't have to go through this whole drug development pipeline, which I'll talk about in a second. New versions of established drugs. Toby is a drug that most CF patients and families are very familiar with. Tobramycin has been around forever. Toby's only been around for about a little over a decade because it's a new version of the drug that is safe and effective to be inhaled. Search for novel treatments. That's the looking for the cure. That's things that have produced medications like the Kalydeco. And then a big thing where the CF Foundation has really been leading the way, not only in cystic fibrosis, but in all models of foundations for chronic disease or for diseases in general, is how they've organized, standardized, and increased the efficiency of clinical research. That's why we can get research companies interested in a disease that only affects 30,000 people nationally and 70,000 people around the world. I always hesitate whenever I say only, especially this population, especially those of you who know me and my history, because that, compared to the number of the millions of patients with asthma and everything else like that, the numbers may not seem a lot. But obviously it's very, very important, and this is still a pretty lousy disease, to paraphrase my aunt's more polite characterizations of this disease. But it is one that requires a lot of work, a lot of research. But to try to get drug companies involved in investing in something they're only going to be able to sell to small numbers of patients, you need to have a catch. You need to give them money. The foundation has done. You need to prove to them that we can do clinical research, that we can do the studies that the FDA is going to require these companies to do to get the drugs approved, and we can do them in a fast way. And that's what's happened with the Therapeutics Development Network. This was first started in 1998. It was about 6 or 8 centers that were just the big research centers: Boston Children's, Cincinnati Children's, Seattle Children's. So the really big places. And in 1998, as we realized that we're going to need to be doing many more patients and more studies to get these drugs done, it was expanded. So in 2009, we were actually invited. I actually received a call from the head of the TDN, because originally I thought, okay, we're a small place, we can't really do this. And she called me up and did some of the work actually with Dr. Kozlowski, some studies that he had done before we joined the TDN. They said, hey, we know you can do this, we want you to do this, we need you in there, get your application in, it's due in 2 days. I had a busy 2 days, but we got the application in and we got approved. And it was a competitive approval. 2 years later, it was a competitive reapproval, meaning just because we had the grant, we're part of the network, we weren't guaranteed to stay in it. And then this past year, again, there was competition. I forget the exact numbers, but I think about 11 centers dropped out and six new ones were added, and we were continued. And this, quite frankly, is due mostly to the work of our research coordinators, who you will hear me mention repeatedly tonight, Teresa Evans and Kathy Mokiver. Teresa's here somewhere. I saw her outside checking people in. Kathy, unfortunately, had some personal medical issues and was unable to come tonight, which is why you can start listening to me again at the end. But the currently TDN is 74 centers. This is the map. They're located, across the country, even in Alaska. Of course, the most important center is this one right here. One of the things, this is actually, I updated this slide, but I stole this from Preston Campbell, who is the medical director for the foundation. Stole the idea. If you look at where CF research has gone historically, it is just exploding. And this is simply, the number of articles. If you just go into PubMed, which is this online research site that anybody can find, and just type in cystic fibrosis, how many publications per year happened. And back in 1950, there we go. And not a lot, and then going every 10 years, a huge expansion, and even just over the 2 years from 2010 to 2012, we've had an increase. This is a slide that you will, I don't know if you'll see it more later tonight, but you see it on the CF website, see it for everything. This is the therapeutics development pipeline, and I'll talk about the stuff down at the bottom in just 2 seconds, the various phases. But these are the drugs, and the ones up here, the CFTR modulation, are the ones that are looking to fix the underlying defect, the ones looking for the cure. As you can see, there's still a lot of new drugs and new research that's being done to get better treatment, help people feel better, live longer, live better lives. And what I haven't done, and they've been putting out these pipelines, it's called, in this format for several years. One of these days, I'm actually going to take the time to make an animation and show how it's grown, but everything has shifted to the right. Everything is getting closer to where it is available to patients, what we really want. So what are the phases of drug development, not only for CF, but for anything else? Preclinical, tests on the bench. Some very smart researchers, some smarter than myself, gets an idea, say, hey, I think if we do this, maybe this medication can kill Pseudomonas better, do something better. And they try it and they test it out in animals. Then when you get to humans, there's 3 phases and actually a 4th phase after the drug's approved. Initial phase, just studies in healthy volunteers. I know we've got a couple college students in here, but this is a way a lot of college students help pay for tuition. These studies look for healthy volunteers, come in, you do a lot of stuff. It takes about a couple months to a year to do. And then phase 2, small studies in CF patients, looking primarily at safety, not really looking to see if the drug works. At this point, all the evidence that the drug works is based on the animal studies. Phase 3 starts looking at larger studies. Okay, and if you look at the number of drugs that, as they pass through, the number of drugs that make it to each stage decrease, because some things with great animals, you start giving it to people, there's all kinds of safety issues. That drug is off the list. Phase 3, large studies in CF patients, basically looking again for safety, but primarily, does this work? Is this something that we can take to the FDA and say, hey, this is a good drug for CF, approve it? And unfortunately, in CF, we've had a number of very promising drugs drop out in this stage. And this does take several years. So if you add it up, you're talking a minimum of 6 years, sometimes up to 10 years, to get things studied. And then after this, you need to submit to the FDA for approval, which often takes quite some time. Actually, the Kalydeco was the fastest drug I've ever seen from time of submission to the FDA to time of approval, which was, I think, about 3 months. It was amazing when January 31st of last year, we got the email that the FDA had actually approved it. Should you participate in a clinical trial? Now, I will give the caveat that the foundation has lots of information about clinical trials, why you should do it, shouldn't do it. What I'm about to talk about in the next slide or two is my personal take, having done this for a while. There's several good reasons to do CF and to do research and participate in research. One, it helps you you're helping find out more about CF and how to treat it. This kind of research is a necessary step. If we don't have patients willing to do this research, the drugs won't get approved. The drugs just aren't there. You learn more about how research is done. Certainly, we've had a number of patients who've done this and said, "Hey, this is something interesting. Hey, I may want to, go to school and be a researcher, when I get older," which is great. There are a lot of patients with cystic fibrosis who are active researchers at both clinical and basic science and all levels. That's the way to fight back. As anybody who's been touched by this disease knows, prior to last year when we were able to at least cure a small number of patients, there was not much we could do. You could do treatments to make things better, but there's still, this disease, nobody's fault, potentially devastating to people, and there's nothing you can do. Well, this is a good way to fight back. This is a good way to know that you're doing something to defeat this disease. Bad reasons. Bad reasons are as important as good reasons. Wanting to be the first to try a new medicine. First off, all these studies are set up what's called placebo control, meaning a certain group will get the medication, a certain group will get a sugar pill. The researchers don't know, the patients don't know. So you may not get the medication, and the medication may or may not work. There may be safety issues with it. I do need to put a caveat in it that, especially in CF, many of the studies of the new medications, while this is true, you don't know whether you get the medication or not, it's true for the study itself. Many of them flip over to what's called an open label study, where everyone who participates actually does get the drug. So you do actually get a little bit more access onto the drug than others. But we still don't know if the drug's safe. We still don't know if it works. So it's not, it's okay to have that in the back of your mind, but that shouldn't be a primary reason. Most importantly, you shouldn't feel that you have to. We talk about research a lot. You hear about it. I just gave you a whole bunch of reasons why we need research and why we need patients to do it. You should never feel you have to. Everyone's got the right. It's not going to change how I take care of Sally or Joe, because Sally said yes to the research project. that I'm working on, Joe said no. We don't do that. If ever research protocol interferes with clinical care, I won't enroll the patient or I'll take them out of the study. Clinical care comes first and always will. So you never have to feel forced or obligated in any way to participate. Things to remember, lots of safety protocols or safety reviews all the time. There's a separate board that's required for every study that does nothing but check on safety, and they're not involved with either the people sponsoring the study or those doing it. If there's any indications of bad effects, the study will be stopped. That's happened several times at CF also. And again, you're sorry for repeating, but it's your choice whether to participate or not. And it's your choice to drop out if you decide you want to stop participating. We don't encourage that because obviously it's a lot of work to get somebody into the study and get things going. So we really suggest that you think about it ahead of time, and that if you do agree to do study, that you actually will see it through. But you absolutely have the right to stop. Lots of information. Again, if you go on CFF.org, they've got a I am the key talks about research. There's there's websites. There's a YouTube site. There's lots of things you can do. Now, I started with the Uncle Sam poster when I gave this talk 2 years ago, and we did it, I think, later in the year. Given this past weekend, I figured I had to update the Uncle Sam to the, especially given my Irish heritage, to last Sunday. So yes, we definitely do want you, and we need people to participate in CF clinical trials. And we have 2 very capable people to work on that, to make that happen. Thank you very much for your attention.